Welcome back to our channel. Today, we're diving into a topic that affects many of us at some point: indigestion and constipation. We are sharing some simple, natural, and over-the-counter remedies to help alleviate these discomforts. Let's get started. Understanding indigestion and constipation. First of all, what is indigestion? Indigestion, also known as dyspepsia, is a condition characterized by discomfort or pain in the stomach or upper abdomen. It can be accompanied by symptoms such as bloating, feeling full quickly when eating, nausea, and heartburn. Next, we need to know what exactly is constipation. Constipation refers to infrequent bowel movements or difficulty in passing stools. It may be accompanied by a feeling of incomplete evacuation, bloating, and abdominal discomfort. Now that we have understood those terminologies, let's discuss the causes and risk factors. Common causes of indigestion include overeating, eating too quickly, consuming fatty or greasy foods, excessive caffeine or alcohol intake, stress, smoking, and certain medications. Some medical conditions like peptic ulcers, gallstones, and gastritis can also cause indigestion. Now let's learn about the factors leading to constipation, which include a diet low in fiber, inadequate fluid intake, lack of physical activity, certain medications, ignoring the urge to have a bowel movement, and conditions like irritable bowel syndrome, diabetes, and hypothyroidism. If you haven't already, please take a moment to like and subscribe to our channel. Now we are shifting our gears and focusing on the remedies and management. First up, let's learn about the dietary changes. Increase fiber intake. Fiber adds bulk to your stool and can help to prevent constipation. It's recommended to consume 20 to 35 grams of fiber per day. Foods rich in fiber include whole grains. Opt for whole grain bread, brown rice, oatmeal, and bran cereal. For example, one slice of whole grain bread can provide about 3 grams of fiber. Fruits and vegetables. Include a variety of fruits and vegetables in your diet. An apple with skin provides about 4.4 grams of fiber, a medium-sized banana provides about 3.1 grams, and a cup of cooked broccoli provides about 5.1 grams. Legumes. Beans, lentils, and peas are high in fiber. A cup of cooked lentils provides an impressive 15.6 grams of fiber. And hey, sharing is caring. If you know someone who could benefit from these tips, be sure to share this video with them. Next, hydration is key. Inadequate fluid intake can lead to constipation. Aim for 8 to 10 cups of fluid per day. This can include water, fruit juices, herbal tea, and even soups. Now let's talk about limiting intake of fatty foods. Fat slows down digestion, leading to an increased risk of indigestion. Try to limit your intake of fried foods, high-fat meats like sausage and bacon, full-fat dairy products, and desserts like cakes and pastries. Next is limiting certain carbohydrates. Some people may experience indigestion and constipation due to an intolerance to certain types of carbohydrates known as FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Foods high in FODMAPs include onions, garlic, broccoli, cabbage, beans, apples, and wheat. If you suspect that FODMAPs may be causing your symptoms, speak with a dietitian about trialing a low FODMAP diet. Now let's talk about probiotics. Probiotics are beneficial bacteria that can promote gut health. Foods rich in probiotics include yogurt, kefir, sauerkraut, tempeh, and kimchi. Don't forget to give this video a thumbs up and subscribe to our channel for more tips. Now comes the most important topic of lifestyle changes. Regular exercise. Aim for 30 minutes of moderate physical activity most days of the week. This can include walking, swimming, cycling, or even gardening. Regular exercise helps stimulate the natural contraction of intestinal muscles, aiding in bowel movements. Healthy eating habits. Try to have meals at regular intervals and avoid skipping meals. Overeating or eating too fast can cause indigestion, so eat smaller, more frequent meals instead of 3 large ones. Also, try not to eat 2 to 3 hours before bedtime to allow your stomach to digest the food. Stress management. High stress levels can exacerbate indigestion and constipation. Techniques such as yoga, meditation, deep breathing exercises, or other relaxation methods can help manage stress levels. Avoid trigger foods. Spicy, fatty, or greasy foods, caffeine, alcohol, and carbonated drinks can trigger indigestion. Identify your trigger foods and limit their consumption. Quit smoking. Smoking can irritate the stomach lining and impair the functioning of the esophagus, leading to indigestion. Last but not the least is the over-the-counter medications. Antacids. Antacids can neutralize stomach acid and provide quick relief from indigestion. They are available in chewable tablets and liquid form. H2 blockers. These medications reduce the production of stomach acid. They are available over the counter. Proton pump inhibitors. These further reduce acid production and are used for more severe cases of indigestion. Laxatives. There are several types of laxatives. Bulk-forming laxatives add bulk and absorb water to soften the stool. Stimulant laxatives stimulate the intestines to move the stool. Stool softeners add moisture to the stool to make it easier to pass. Finally, when to seek medical help. If symptoms persist despite these remedies, or if they are accompanied by weight loss, vomiting, severe pain, or blood in the stool, seek immediate medical attention. Remember, while these remedies can help manage symptoms, they may not address the underlying cause. It's essential to consult with your healthcare provider for a comprehensive treatment approach. This guide is not a substitute for professional medical advice. Always consult with your healthcare provider before starting any new treatment or making changes to existing treatment. Lastly, we would love to hear from you. Any questions or feedback about today's video? Please don't hesitate to drop a comment down below.